Hi, I'm Dr. Theresa Oswald from Knowledge is Medicine, and today I want to talk about my 4 favorite things to help reduce pain. So the first thing is that a lot of times pain is related to inflammation in our body, and we often use anti-inflammatory medicines, over-the-counter medicines, to help reduce inflammation. But one thing you may not be thinking about is that things that you put in your body through your diet actually may be promoting inflammation. So there's an anti-inflammatory diet that looks at things that that are known to cause inflammation and reduce those in the diet. And a couple of the main things are certain kinds of oils and fats, like trans fats or fats that are in processed baked goods, or chips or crackers, or things that can have a long shelf life. And then also things that are high in saturated fats, like red meat and high-fat dairy. Those things can actually increase inflammation in your body. And then there's things that help fight inflammation, like certain phytonutrients, plant-based nutrients, things that are common in the Mediterranean diet. That is the kind of the backbone of an anti-inflammatory diet. So increasing olive oil and vegetables of many different colors, as well as anti-inflammatory spices like turmeric and ginger. So one of the best tips for reducing pain is to see what you're eating. You really are what you eat. And it's really important to look at your diet and make sure that is as optimized as possible before you start adding supplements in. Because if you're putting a lot of pro-inflammatory chemicals or things that cause inflammation in your body through your diet, and then you're trying to reduce inflammation with a supplement, the two things are fighting each other. So you want to look at your diet first and then add supplements second. Then the next thing that I think is very important about pain is getting enough vitamin D, vitamin D3. Now this we get through the sun, but only in certain areas of the country do we get vitamin D from the sun the entire year. So where I practice in the northern United States, between about October to March, even if you go outside in shorts and a t-shirt, which I don't know why anyone would, because right now it's like -5 degrees outside, but even if you did, you wouldn't be able to convert that vitamin D into its usable form in your skin from the sunlight, just because of the angle of the rays of the sun. So if you're having pain, especially if it's more generalized pain, please talk to your healthcare provider about checking your vitamin D level. Now, vitamin D is a fat-soluble vitamin, which means that you can take too much. So if you're worried about it, you shouldn't just go out and take as much vitamin D as you think is good. You really want to get your level tested. Before that, if you're not taking any vitamin D at all, for most people, a dose of 1,000 international units a day would be a good starting spot, and then having your level tested to see if it needs to be adjusted. So then the next thing that I find super important to helping people that are trying to reduce or control their pain is simple breathing strategies. So there's been studies that show that slow, steady, deep breathing actually increases your pain threshold. That means that you have less pain at a certain amount of stimulation. So an increased pain threshold is good. So slow, deep breathing, it can be very soothing to the nerves and to the nervous system, and it actually can reduce pain. And then lastly, when you're dealing with pain, a lot of times it feels like there's a sense of isolation. You don't get out, you don't get support from your friends and family, and that actually can slow the healing. So trying to connect with people, even if it may be a support group of other people trying to deal with pain, but getting out and getting in touch with other people and getting support, whether it's in person or online, whether it's through friends and family, or if you really feel isolated without a lot of support where you live, just simply volunteering, even an hour every couple of weeks, gets you out, gets you connected, gets you those feel-good hormones of being around other people. And they have shown studies that show that women that are dealing with breast cancer, they took two different groups. the women who were the same age and they had the same degree of disease process and they were getting the same treatment. But the women that were in a support group tended to live longer than the women that were just getting the standard care without a support group. So it seems like it's just a feel-good thing to get out and get connected, but it actually helps with your healing. So those are my 4 top go-to strategies for helping pain. One is looking at your diet and reducing inflammation in your diet. Next is make sure you're getting vitamin D if it's in the form of sunlight. If you live in the southern United States where you can get out and have your arms and legs and face exposed to the sun. Now, if you have a personal history of skin cancer, you don't want to go out there without sunscreen. So therefore, even if you're out in the sun, you may not be getting the vitamin D conversion and you might need a supplement. Then the breathing strategies can be very simple but very profound, especially looking at how breath work reduces pain threshold, slows your breathing rate, reduces your blood pressure. So these strategies can be done very easily with just your own natural breathing pattern, but can be very potent in pain relieving. And then lastly, being in a group, whether it may even be an online class, and that's why in addition to the YouTube channel, I want to offer online classes so that people can work in a group to help brainstorm and mastermind strategies to help with their healing. So I'm really happy you found the YouTube channel. I hope you stay tuned for more helpful hints. I'm Theresa Oswald at Knowledge is Medicine.